Hi guys, we are back. So this is our blood exposure or our core domain number 10. What does that look like? A lot of people are confused as to what they should be doing in this core domain, so I'm going to lay it out there for you so you know exactly what you need to do. So let's jump into it. All right, working area nice and clean. Proctor's going to read the instructions to you, or the script. How many times? Twice, yes. After the second reading of the script or the directions, they're going to instruct you to begin. So what are we going to do? Sanitize our hands. And in the script, they're going to say something to the effect of, you have sustained a minor cut, nothing as to where you can't continue with the service. You haven't really been injured to the point to where you have to stop the service, and the guest hasn't been injured. So at that point, it's going to be your index finger. So you sustained a minor cut on your index finger. So as I said, we're going to sanitize the hands. We're going to hold that finger up. We're going to take our blood exposure packet or bag that was living on our universal supply area. We're going to keep that finger up. We're going to open up that bag, and we're going to place the contents of the bag onto our working area. So what are we doing first? First thing we have, keep that finger up, is we have our paper towel. So we're going to take our paper towel and we're going to place it here on our working area, because once again we still have one more core domain left, which is hair removal, if you're testing in Virginia, Georgia, or North Carolina. South Carolina, this is it for you. Okay, blood exposure is the last one. So keeping that finger up, I remove my paper towel from my blood exposure bag. I'm going to remove my hazardous waste bag, so it was double bagged. Keeping that finger up, I'm going to open that bag, keeping my finger up and out of contact with anything, and I'm going to open it up, fold it over so that it's open this way, keeping my finger up, open this way, and I'm going to place it right in front of me, okay? I'm going to move her over just a tad bit so you all can see. All right, so I'm going to now remove the other contents from my blood exposure bag, which is going to be a pair of gloves. You're only going to need one glove because you're going to glove the hand that was injured, but you want to just always have an extra, because what if you're removing the contents and your glove falls and you only have one? Guess what? Points are going to be deducted because you have not properly demonstrated the procedure. So give you two just to be safe. So here, my gloves are going to live on my towel, my paper towel. I'm going to take out my Band-Aid. Now I have additional Band-Aids because once again, if you drop something, guess what? You're still prepared and you can move forward with the task. So got my Band-Aids here. Okay, just additional, just in case. Yeah. Okay, and then lastly, I have my wipe. Okay, disinfectant wipe, antiseptic wipe, alcohol wipe, it doesn't matter. Have that there as well, and that's going to live on my towel as well, or my paper towel. So what happens to this bag? We no longer have a use for it. We can't reuse it, so where is it going? Where's it going? Trash. Okay, so finger still up. We're going to open up our wipe. Everything that we use is going to go into the hazardous waste bag. Why is it labeled hazardous waste? So if anybody were to pick it up, guess what? They're going to know that there's something hazardous blood related, so they're not going to open it. So everything that we use is going to go in there. So I'm going to open up my wipe, right? I'm going to take my wipe. I'm going to wipe the infected area or finger, the cut finger. And what am I doing with this? Going into my hazardous waste bag. Yes. Now I'm going to take my Band-Aid, open it up. All the wrappers and everything are going to go in my hazardous waste bag as well. Keeping that finger up. I'm going to take my Band-Aid out. Wrapper goes there. This comes here. Keeping that finger up. I'm going to place my Band-Aid on my finger. And then I'm going to take my glove. And I'm going to place it on my hand. That's it. That's the blood exposure procedure. So, what do we do with everything else? You got the injured finger, the hand is gloved. You're going to take all the remaining things that you have that live on top of your paper towel. Even if you haven't used them, you're going to put them where? Hazardous waste. This is going to go where? Into my hazardous waste bag. And the proctor is going to be standing with you, assessing you. So this is going to go here. You're going to close it up like so. Okay? Done. All right? So this is going to go here. Trash. They've already seen you do the exposure. So at this point, that pore domain is completed. You can take this off. Sanitize your hands. And that's it. So, as I said, Georgia, Virginia, North Carolina, you're going to move on to hair removal. Whereas South Carolina, this is the last core domain for you. At that point, they're going to thank you for participating in the practical exam. They're going to ask you to remove all items from your work area, your testing area, to disinfect, sanitize, and disinfect. So your whole work area, you're going to disinfect. So you're going to wipe down once you remove everything. You're going to do the same thing, just how you disinfected in the beginning where you had your gloves. You put your gloves on, you would use your barbicide wipe and wipe down everything, and then put everything in the trash. That's what you would do for South Carolina at this point, once you completed the blood exposure. But for Georgia, North Carolina, Virginia, we're going to move on to the last core domain, which is going to be, as I said, hair removal. Thank you for watching. Thank you for watching all of the videos. I hope that these videos have been helpful to you. If you should have any questions, comments, please, by all means, put it below. Put those things below. I would love to answer questions. I would love to get your feedback as to what worked, what you enjoyed about the videos, what you feel needs a little more work. Love the feedback. At the end of the day, just want to make sure that you all do an amazing job with your practical exam, that you pass and you become licensed stylist. So once again, thank you for the videos or watching the videos, and pass it on. If you know someone who's going through a practical exam in either of the states that I've mentioned, by all means, pass it on. Thank you so much. Congratulations. And it's been fun. Thank you. Bye-bye.